Okay, here we go. All right, so Healing Pathways is a project that involves 8 communities in Wisconsin, Minnesota, and Ontario, Canada. And you can see a lot of details about pathways here. I'm not going to go into a major amount of detail because of a lack of time, but this is one cultural group in the Northern Midwest, and it represents 20 years of partnership between our team and these 8 communities. At baseline, we enrolled 735 Native youth, so American Indian and First Nations, between the ages of 10 to 12 years. And I really like to show this timeline because we started with annual assessments, survey assessments of mental health, substance use, culture, family dynamics with the target participants, the kids, G2, we call them, Generation 2, and their parents. So we have 2 generations of data for the early first 7 to 8 years of the study. Then we reconnected with those kiddos in 2016 in their late 20s and have 3 years of data from them then. Then we moved into a COVID situation. And now we got funded for a 3rd generation study where we're enrolling the kids of the target participants. So Wave 12 launches next week. Run!
Okay, so it's actually really challenging to condense 20 years of research into a few slides. So we selected those more studies that we think really kind of show where what we found and where we're going. And so in the adolescent waves, we focused on cigarette, marijuana, and alcohol use. And the slide title is substance use initiation. So like at what ages are kids starting to use these substances? And the median age of onset for smoking cigarettes was about 11 years, and alcohol was about 12 years old, and marijuana was slightly later at 12 and a half years. So on average, that's when kids were starting to use these substances. But as we talked about yesterday, average effects don't really tell us a lot about what's actually happening in the data. So in this figure, in this slide, we're talking about the different trajectories of use. And we've done this in a couple of studies, a couple of papers, but the one that we're showing up here was one that Dane, Melissa, and I did a few years ago on how are kids, are they using alcohol alone, or using marijuana alone, or are they using both? And so you can see the trajectory figures on the side that show that there's different patterns over ages 10 to 18. And so there's also different patterns of co-use. So there's the largest group of kids are not using either of these 2 substances. And then there's a group that's using both at younger ages. So the early onset combined, they're starting to use alcohol and marijuana in the same year at about age 11. And then another group is using alcohol and marijuana in the same year at about age 14. And then there's another group that is really only using alcohol in adolescence. But so there's different patterns that emerge in adolescence. We also see different peak periods of risk in the development of substance use disorders. We collected diagnostic data at 4 different time periods in adolescence to look at how many kids are meeting criteria for more problematic substance use and when is that happening. And so new cases of alcohol tend to peak later, or tend to continue happening later. So around wave 6 when they're about 16 years old. But new cases of marijuana use disorder and nicotine dependence come earlier at wave 4 when they are about 14 years old. So there's different peak periods of risk for the onset of substance use disorders. Mm-hmm. And those trajectories tend to continue down. We did another wave of diagnostic interviewing at wave 9 when they were about 25 or 26. So for alcohol, marijuana, and nicotine, the rates of disorder continue to decrease into their adult years. And that'll be relevant for when Dane starts talking. And then also, it's a pretty established fact in the literature, and one that we can see in our data, that the earlier kids start using substances, the greater the chance of them developing a substance use disorder, but also continuity in continuing to meet criteria for a disorder. And so for nicotine and marijuana, this is quite pronounced, that if for those who meet criteria for nicotine dependence or marijuana use disorder over multiple waves of assessments, they tended to start using those substances at younger and younger ages. It's less pronounced for alcohol, but in general, the earlier they start using, the more problematic it is for them for longer periods of time. And we also have looked at risk factors for substance use from the very beginning of healing pathways. And so this is just summarizing across those three main substances. And the risk factors in red appear across multiple substances. So for example, being female is associated with greater likelihood of using cigarettes and marijuana. Having depression or more depressive symptoms increases risk for using cigarettes and marijuana, and then having a caregiver who had depression also increased risk for those two substances. But we've looked at a variety of risk factors across all the years of the study. And then in terms of substance use disorder, there are slightly different predictors that we've studied, but you'll see that there's a lot of commonalities in who's meeting criteria for alcohol abuse or dependence and marijuana abuse or dependence. So being female, having a lower family income, and then we also kind of see evidence of sequences of substance use. So meeting criteria for nicotine dependence increases the risk of somebody meeting criteria for alcohol abuse or dependence and marijuana abuse or dependence. And likewise, meeting criteria for alcohol use disorder increases the risk of developing marijuana use disorder. So we've found that there's a variety of predictors to tell us who's likely to develop these when they're adolescents. And now it's Dane's turn.
Simple slide.
Okay, we're continuing to throw a ton of data at you. So remember at the beginning when Melissa mentioned the kind of timeline of this project, Kelley presented on the first 8 weeks of data that spanned all of adolescence. There was about a 5-6 year gap in funding, and then participants were followed up for another 3 years. So I'm going to present on some of the early adult substance use trends. This first slide, if you look at the top, this is the past year prevalence for alcohol, marijuana, methamphetamine, heroin, and prescription pain pill misuse. And I compared it to the rates of the 2019 National Survey on Drug Use and Health, which is the same year that Wave 10 was collected. So you can see for alcohol use, rates are on par with national averages, and marijuana is slightly higher, but not that drastic. I think some of the more, I highlighted them here. If you look at the rates of methamphetamine use, in the past year, about 18% of Healing Pathways participants have tried methamphetamine, which is almost 20 times higher than the NISDA averages. And similar trends for heroin and a little less so for prescription pain pill misuse. One other, I know some of you as part of this P50 are interested in this idea of polysubstitute, so this idea of using 2 or more substances. We measured at Wave 10 whether or not they've ever used each of these substances, each two-way combination at the same time within the past year. So you can see it in this bottom table. I have rates of any co-use of any substance across these. So if you read them in columns, so for alcohol users and marijuana users, they tend to co-use the other substance, which is not uncommon. One thing that really stands out is among people who use heroin. So again, only about 8% or 9% of the sample, 2/3 also co-use methamphetamine, which matches trends that we see in the upper Midwest in Minnesota and other tribal communities working on different opioid-related projects, that methamphetamine is kind of overlaid on top of opioid use. Which brings me to this next slide. So Kelley mentioned rates of substance use disorders for nicotine, alcohol, and marijuana. They're almost non-existent in adolescence, but you see a sharp increase from waves 8 to 9. So they go from almost 0 to, I don't quite know what the prevalence is. I took that slide out, but one interesting part of having 20 years of data is we can map trends that we see in the study onto trends we see nationally. So in this case, the opioid epidemic. So in this slide, I tried to map this on by year rather than age onto what we see in terms of overdoses. So the 3 waves of overdoses were with prescription pain pill misuse in the late 90s through about late 2000s, followed by, so you'll see that, so that's the blue there. And then in the gray is heroin, and orange is methamphetamine. So these are rates of new cases. You can see prescription pain pill misuse. You saw most new cases occur in about the mid-2000s, and you saw heroin and methamphetamine rates, rates of first use start much later. We also assessed non-fatal overdoses and when it occurred. So about 12% of the Healing Pathway sample reported experiencing a non-fatal overdose. And you can see most of those have happened since 2010, which also mirrors what you see nationally, which you see that large spike largely due to synthetic opioids like fentanyl.
No, go ahead. Sorry, I just cleared my throat.
And unfortunately, we do have about 40 some participants who have passed away in Healing Pathways, and we do know at least 5 participants have passed away because of overdoses involving opioids. So that's not part of this. That's something we're kind of exploring as part of this analysis. But I think this is kind of an interesting aspect of Healing Pathways. We have so much data, we can start to map it onto some of these trends we see nationally. So
Back to me, okay. I would say underlying all of this, which you all know in this room, Kelley presented proximal risk factors, but this study also innovates on measures of historical trauma, whether it's boarding school, out-of-home placement and foster care, residential schools, relocation, all these things. And those are the deep root causes of all of these inequities. So we have to remember that even in the context of the proximal risk factors. The other thing Pathways is known for, I think, from most people is innovating on measures of cultural strengths. So early in the study, enculturation was a 3-pronged approach to measurement, and we have a variety of measures that we will share with Circle teams. And then you can see underneath, we've really innovated to expand those in recent years. And again, Circle, we are a team, we share those measures. These are not, we are simply stewards of the data within the communities we work, and the measures are funded by federal dollars. We also really seek to celebrate strengths. I talked about that earlier this week. So important takeaways, I think you sort of got them, but we're moving into wave 12. This is a lot of words, but here we will look at some things that are similar to Circle. Heterogeneity or difference across the 3 generations, and what predicts substance use, what predicts not using. Are there differential patterns in the way we even think about substances as we kind of decolonize our brains around that? What does recovery look like, so on and so forth. And we'll also do, for the first time ever in this longitudinal study, an aim dedicated to qualitative interviewing, which is shocking to believe that that hasn't happened, but finally.